Hello friends, greetings from Dr. Sharad Kasarle. Today's topic of discussion is chronic fatigue syndrome. That is almost you feel drained of energy and fatigue levels reach to the optimum or maximum. If you notice joint pain that moves from one spot to another, chronic muscle pain including low back pain or bones and joints inflammation or even frozen shoulders, you are not able to concentrate, focus at particular activity, loss of memory, cognition, enlarged lymph nodes, chronic headaches that are linked to even migraines and sinusitis, chills and night sweats, digestive disorders like chronic constipation, irritable bowel syndrome. These are the symptoms associated with chronic fatigue syndrome, which is known as CFS. Sufferers of chronic fatigue syndrome also experience significant alterations in levels of irritability, mood swings, panic attacks, anxiety, and depression. CFS is linked with hormonal imbalances, poor immune system response, various viral infections, chronic low blood pressure, and nutritionally deficiency, mainly magnesium and potassium, are contributing factors. In addition, research indicates that chronic fatigue syndrome may be linked to oxidative stress, celiac disease, and food sensitivities or food allergies. Viruses that can cause CFS include HHV6, HTLV, parvovirus, and measles. Often individuals with chronic fatigue syndrome are prescribed antidepressants and sleeping pills. In many cases, the side effects from these drugs are actually worse than the original symptoms. Instead, my scientific recommendation is addition of vitamin B complex, alternative and complementary health practices, a well-balanced diet rich with potassium and magnesium, and elimination of food allergens. What are the food allergens? Mainly gluten. Some people have gluten intolerance leading to celiac disorders. Lactose intolerance. Lactose or dairy products are also classified under allergens. Soybeans, also peanuts are allergic to some people. Magnesium, L-carnitine and SAMe, that is known as S-adenosyl L-methionine. This is an amino acid extremely useful in treating fibromyalgia or chronic fatigue syndrome. Adaptogen herbs like ashwagandha, shatavari, they are highly blessed herbs to improve strength, stamina, and get back your energy levels by enhancing the cellular mitochondrial energy levels. So, ashwagandha and shatavari are beneficial for patients suffering from chronic fatigue syndrome. As I keep on mentioning the wonderful medicinal benefits of Brahmi enlightens, or you can say enriches, our gut fire, that is Brahmagni, normally is known as Jataragni, and it improves gut brain axis connectivity, and in a way it treats your chronic fatigue syndrome. Suggestion is to consider taking an IgG, that is immunoglobulin test, to help you determine the foods that you are sensitive to, because we must know which particular foods we all feel allergic to. Then you can eliminate them from your diet by getting rid of your personal known allergens. Symptoms of IBS, that is irritable bowel syndrome, ADHD, attention deficit hyperactivity disorder, you are not able to concentrate, focus on certain activities due to chronic fatigue syndrome, cystic fibrosis, rheumatoid arthritis, and chronic fatigue can potentially be relieved by medical nutrition therapy. One has to supplement magnesium and potassium, as I mentioned, and also omega 3 fatty acids mainly from fish oils and flax seeds and chia seeds. They are highly beneficial in re-energizing your cellular mitochondrial levels and in a way to treat chronic fatigue syndrome. Reducing your sugar intake and controlling salt levels is key in maintaining your healthy blood sugar levels and blood pressure. Keeping blood cholesterol levels or blood lipids is a key factor in the management of chronic fatigue syndrome. Native cholesterol is not bad, but oxidation of this native cholesterol, that is oxidation of LDL, mainly the risk factor for atherosclerosis or arteriosclerosis and cardiomyopathy or myocardial infarction and sudden cardiac arrests. Exercise improves HDL cholesterol, which is a good cholesterol, which is highly beneficial for your energy levels as well as the functions of heart, brain, kidney, reproductive system, bones, joints, muscles, and every cell of your body rejuvenates when you exercise. Drink at least 2 liters of water. Water is the rich source of oxygen and it oxygenates all your cells, which is a very vital and critical nutrient for your survival. I am sure this audio will find you very, very useful. Thank you very much. God bless you all.